Our pathogens are hepatitis A, B, and C. Hepatitis A is caused by the hepatitis A virus. Its scientific name is HAV. Hepatitis B is caused by the hepatitis B virus. Its scientific name is serum. Hepatitis C is caused by the hepatitis C virus. Its scientific name is HCV. All hepatitis A, B, and C rarely cause liver damage and death.
The symptoms of hepatitis A, B, and C are yellowing of the skin and whites of the eyes, fever, loss of appetite, fatigue, dark urine, joint pain, abdominal pain, diarrhea, nausea, and vomiting.
Hepatitis A is usually spread by close personal contact. It also can be spread by eating food or drinking water contaminated with HAV. Hepatitis B is spread when blood or body fluid from an infected person enters the blood of a person who is not infected. It is also spread by unprotected sex with an infected person, sharing needles, or from an infected mother to her baby during birth.
Hepatitis C is spread when blood or body fluid from an infected person enters another person's body, or when shooting drugs through exposure to needle sticks, or from infected mother to baby. The most common place to get hepatitis A, B, or C is in the United States.
There is no treatment for hepatitis A, but avoiding alcohol can help. People with hepatitis B should have a medical evaluation every 6 to 12 months. Several antiviral medications are currently licensed for treatment of persons with chronic hepatitis B, but there is no medication to treat recently acquired hepatitis B infection.
People with hepatitis C should have a medical evaluation every 6 to 12 months. There are drugs licensed for the treatment of persons with chronic hepatitis C. There are also no medication for the treatment of recently acquired hepatitis C.
Here is some history of hepatitis. During the 19th century, popular speculation as to the cause of jaundice, the yellow color of skin, was an obstruction of the common bile duct with a mucus plug. This was an indication of hepatitis A virus.
During World War II, serum hepatitis, which is hepatitis B, is clearly established as a separate entity and the cause of hepatitis B. Because both hepatitis A and B were highly epidemic in school, most children became infected naturally after admission. Hepatitis A was known as a small filterable virus. Studies show that the disease, which is hepatitis A, in children was milder than in adults and usually not afferent in infants. In 1963, scientists developed blood tests to identify hepatitis B. Later on in 1973, scientists developed blood tests to identify hepatitis A. In 1992, scientists created a blood test for hepatitis C. From the 1980s to the 1990s, about 300,000 Americans were affected by hepatitis C through blood transfusions or blood products.